Paul wants to join the conversation. He's saying, talk about the mortality rate. He's saying the mortality rate is 0.001%. How is it that you used to be safe at a bar with a hamburger in front of you, and now you're safe at 9:59 p.m., but not at 10:01 p.m.?
Yeah, so let's break this down a little bit. So yeah, I agree. So it's all about, I mentioned in the past, my comment of probability. It's probability of infection. The longer you're around someone with COVID-19, the more likely you are to get infected. If you shorten that time interval, you can't stay out till midnight, you can stay out till 10, it's going to have some type of effect. That's the first thing. The other thing I like to tackle is we're going to do some basic math here, very basic math. We're going to look at the US. There are 246,000 deaths in the US, and there are 11.1 million cases. If you do the math, that's a mortality rate of 2.2%. Now let's take a look at the world. There are 54.5 million cases in the world, and there's 1.32 million deaths. Let's do the math. That's a mortality rate of 2.4%. So the mortality rate in general is about anywhere, if you read 1 to 3%, that's a lot of deaths. This number of 0.001 is, I don't really think is realistic. These are actual numbers, not made up numbers. So the mortality rate's higher. And we talk about mortality, but it's also getting the virus and not dying from it. People still have health adverse effects: fatigue for 5 to 6 months, chest pain for 5 to 6 months, not feeling themselves, coughing, chest pain. There's a whole host of symptoms that happen in patients who get COVID-19. It's not all about death.
You know,